My name is Sacharais Von Koch, and I work as a PhD student and junior physician at the Department of Cardiology at Lund University Hospital in Sweden. So we wanted to understand how the Prevail drug-coated balloons performs compared to other DCB in a real-world practice. So the Prevail DCB is a paclitaxel DCB that uses urea as an excipient. And there's very limited clinical experience on this device. And there's also limited clinical experience on comparing different types of DCB in general. So since this device is widely used in PCI, we felt it was of importance to evaluate its outcome in a large, unselected patient population. So with this study, we aim to provide a clearer picture of how these balloons perform. So to assess this study, we conducted a retrospective observational analysis using data from the Swedish coronary angiography and angioplasty registry. This is the national PCI registry in Sweden. And using this study, we included all PCI procedures in Sweden with drug-coated balloons between 2021 and 2024 in Sweden. Exclusion criteria comprised of uncommon DCB and also procedures in which both Prevail DCB and other DCBs were used. But other than that, we aim to include an unselected patient population, and we included over 6,000 patients who were treated with either the Prevail drug-coated balloon or other contemporary drug-coated balloon. And to ensure a fair comparison between the two groups, we applied a multivariable analysis to adjust for baseline data, and we followed patients for 2 years to assess longer-term performances. This is decisively the largest study to date investigating the use of Prevail DCB, and to the best of my knowledge, it is also the largest study to compare the use of different types of DCB. And our results were neutral, meaning that there were no difference in clinical outcomes between the Prevail DCB and other contemporary DCB at a 2-year follow-up. Both groups had, for example, similar rates of target lesion revascularization. They had the same rates of myocardial infarction and also mortality. And these results suggest that Prevail DCB perform just as well as other DCBs in a real-world setting. And I think the key takeaway to this is that in a real-world setting, the Prevail DCB is as effective and safe as other DCBs. So in this analysis evaluating the 2-year results, I think the main finding that Prevail DCB had a comparable outcome compared to other contemporary DCB, I think that was expected and in line with our expectations. However, in the subgroup analysis, when comparing Prevail versus other DCBs for patients who also underwent stent implantation in the same procedures, we actually found that Prevail DCB was associated with lower rates of myocardial infarction. But with that being said, since this was an observational study, I think our findings should be interpreted with that in mind, and I think further investigations from randomized trials would be needed to confirm these results.